everyone. I'm Solamay Tibabu, your host of the Expanding Access podcast, where we cover all things expanding access to mental health, addiction, and IDD support through technology, health equity, and innovation. And so, of course, I'm so delighted to have Matt as our special guest today. We have so much great content to cover. I'm just really blown away by not only his professional experience, but really his personal journey that has brought him here. So thank you so much, Matt, for joining us.
Thanks so much for having me. Super excited to be here.
Why don't we get started by just telling a little bit about yourself, share a little bit about your personal journey that led you to founding Accountable and how that experience shapes your work today.
Sure. Yeah. So high level, I'm someone in long-term recovery. My background's in technology. So kind of how I got here and why I founded Accountable was when I was building up my last company, which was a behavioral health platform in EHR for applied behavior analysis providers. I also had a really bad opioid addiction, not that there are good ones. I overdosed in 2013. From there, went to inpatient treatment and then moved back in with my girlfriend, who's now gratefully my wife in New York City at 25. And in that time, I had the experience of her being terrified and wanting to drug test me, and being drug tested by your spouse just isn't great. And then also had the same experience of I needed more support. Being 25 in New York City as somebody who liked to party, especially coming out of IOP, I was incredibly lonely. I didn't really know who I was anymore or where to go. And I didn't know the best way to find support for myself. And everything I saw out there felt like it was priced to desperation. And as somebody who was bootstrapping my last company and had a very expensive drug habit before I got sober, it was really, really, really stressful. That experience stuck with me. And as I got sober, the last company did a lot better because I wasn't high all the time. Eventually sold it to a company called Therapy Brands at the time, which is now in Serel Health. Led the ABA division there for a few years, and then left to start what's now You Are Accountable. With that, my co-founder AJ is somebody that I've known for quite a long time. We actually spent 3 years in therapy together in a group for people in long-term recovery, so we communicate really well. And when he got sober, he went back to school to become a social worker. Most recently worked in Hazel and Betty Ford's IOP, where we were actually both patients. And when I had the idea for Accountable, I reached out to him because I'm just a sober tech guy and needed someone to run our coaching and peer support program, which I think is just as important as the technology and testing part of our platform, if not actually more important. So that's how Accountable came to be. High level, what we do is we provide online peer support, toxicology monitoring, and care coordination for individuals, both pre-contemplative all the way through as they step down from treatment and helping them sustain their recovery.
Wow. Just every time I hear it, I'm blown away by your story. And it's like every sentence is such a major chapter that you say so nonchalantly, but it's just remarkable and so inspiring. So thank you for sharing that. And even in what you said there's just so many different levels of care when it comes to addiction treatment. Can you tell our audience a little bit about what gap in the recovery process did you really see that made you realize that Accountable needed to exist?
Sure. So, I'll start with really, and I'll say this all from my experience. Before I went to treatment, I was in a place where I had no insight to how bad my addiction was, but at the same time couldn't go a day without using drugs. And the crazy thing about addiction is that in all this time, me waking up and using every day felt like I was making a choice to use. But the reality is that there was no choice at that point. It's, it's an illness that convinces you that you're well. So I bring that up as framing because, and I'll say when I overdosed and I was in the hospital and I had almost died and had double pneumonia and was in the ICU, I was still convinced that I didn't need to go to treatment, that this was all a big mistake. I can just go home and I won't do this again. The what I had found is like I went to inpatient treatment at a wonderful place. I'm still really close with them. And at the end of the treatment episode, I was in treatment in Utah and I just got dropped at the airport. And I was by myself. And after being inpatient for 30 days, being dropped like in public in an airport by yourself was like such a jarring experience. And we see that all the time. People come out of treatment and immediately relapse because it's really easy to stay sober when you're in an institution, much harder when you're back out in the environment that you were in the first place. All I could think to do in that time was drink a bunch of Red Bull in the airport, which is probably not the healthiest thing to do, but much more healthier than the alternatives, right? So really like what I had felt is as people are going through levels of care or building insight even before care, the process is really disjointed. Like the inpatient providers do a great job with building insight and stabilization. Then you're connected to an outpatient provider that's a different institution, and like hopefully you land there. When you're in outpatient, you have family, you have individual providers you might work with. So my girlfriend, who's now a wife, I had my individual therapist, I had my psychiatrist, I had the IOP counselors. None of them had a really good way to talk to each other. So like, and when people are in active addiction, like we split, we lie, we do things to protect our illness, which makes it really hard for people to help you. So the disjointedness between levels of care, but then also the inability for different people in the ecosystem to communicate was just something that was a glaring gap for me. But also the support for family to feel safe is also missing in that entire process. And then the one last piece that I'll add, which is really the importance of peer support for me, is in my addiction and after, like the first feeling I had when I woke up in the hospital after overdosing was immense shame and feeling like my life was over and that I was found out and like I was never going to come back from this. In hindsight, it was like the best day of my life. But at the time, it felt like my life was over. And that shame for me, and I think for a lot of people, carries into the treatment setting. And how that plays out is I see a therapist and they tell me I should do certain things, but it's hard for me to receive that because I feel like I'm being talked down to and I'm broken. And the suggestions, especially to like me, who's an engineer, the suggestion of like calling a friend when like you're struggling seems silly and demeaning. That's how it felt to me. But that actually works. If you're listening to this, you should totally do that. But hearing that same suggestion from somebody who like had been where I was and was actively doing it melted away that shame that I had and made me able to receive it. So that's the power of the peer support and the work that we do. It's walking side by side with someone who, is like no one comes into recovering from addiction winning at life. Like me particularly, you're like rolled into rehab on like an oxygen tank. Like I came in pretty low, but like nobody's winning. So having someone who can be like, hey, I was in that spot too, and this is how I crawled out of that hole is just like immensely powerful.
Wow. Thank you. That is just, I think a lot of folks in our audience might think that peers can serve as a workforce extender, which of course, they do, but not as replacements necessarily to address our clinician workforce shortage. The reality is that peers have such a powerful role that only they can fill. And you couldn't have said it better. What a excellent example to demonstrate that. And, in fact, I suspect some people in our audience right now might even be struggling just statistically as it relates to addiction. And if you could say something to them of like, what first step would you take if you were in their shoes at this moment?
Probably the hardest step to take, which is ask for help. For me, I always considered myself like a self-starter. If I put my mind to something, I'll get it done. This was truly something, and I would have never asked for help for anything. One thing that I've learned in recovery is that asking for help is actually a superpower. It allows me to accomplish like so much more than I ever could on my own. So if addiction was something that people could solve on their own because they wanted to, nobody would struggle with addiction. Nobody in their right mind would put themselves through what I put myself through. So the true first step is being willing to ask for help, or if somebody offers help, being willing to receive it.
Yes. So much easier said than done, but I'm glad that you could hit that message home, because what an incredible difference it could make. And I do encourage those in the audience listening. Now, all the things you're saying, of course, it's amazing what you've done and how this has come together, especially with your co-founder's lived experience. And I know that some payers and providers could really benefit a lot from this experience, but might not know how, or maybe you could talk a little bit about how you work with providers and payers to support them in supporting their patients.
Sure. So, first thing I'll say, to be clear, that I don't believe peer support is a replacement for clinical care. Clinical care is still unbelievably important. And the way we see ourselves is as an adjunct to that. What you get when you're working with peer support as a provider is not necessarily like a workforce extender, but a partner in helping somebody recover. So what that means is people who engage in peer support are much more likely to follow treatment recommendations. They're much more likely to be engaged and happy with their treatment. They're much more likely to sustain recovery, frankly. On our end, what we see is our NPS is 91, which is unheard of, and we're drug testing people. The therapeutic alliance that we see built with our coaches is just truly unparalleled. When we've done studies in the past, the treatment alliance questionnaire is always off the charts. And that's because we can build up a true relationship through shared lived experience. So, to backtrack, what you get as a provider is a true partner in care. The reason why treatment centers refer to us as part of aftercare is because they know that their members will have someone to work with from the moment they step out the door. So when they go to the airport, like I did, they have someone to reach out to. If their alcohol use disorder, we'll set them up on a breathalyzer before they leave, so they have that point of accountability. For also working with outpatient providers, especially in the virtual world, right? This is why we have our partnership with Charlie Health. It's really hard for virtual IOP patients to get the testing. They have to go to a lab. It has to be coordinated. It's a lot of work for the staff. Through our technology, we actually handle all of that, so it's all automated. And the testing goes from something that can be felt as a punitive measure, and I have to do this, to a supportive measure. So when we have a member that either has a positive breathalyzer or fails a drug test, it's not a "hey, we got you." It's a "hey, let's talk about what happened. How can we support you in using your voice with this?" Because also, I could tell you from my perspective, when I had relapsed, my wife would be angry, terrified, and just everything comes out sideways. So as peers, we work with the individual, the family, and the clinicians to help put a proactive and productive plan in place to get somebody back on track. And what that looks like, and what we see with our commercial payer contracts, with the outcomes we're getting, is that results in lower readmissions, dramatically lower readmissions, cost savings by a third, and maintaining of patient satisfaction scores, like I said, with an NPS of 91. So it's really, truly a way of providing accessible, affordable, wraparound support, no matter the level of care somebody's in. On average, we work with people for over 10 months. So we're really getting somebody from their beginning of their recovery journey through true stabilization, where they found what their long-term program of recovery is going to be, whatever that may be.
Incredible. And, being a technologist yourself, and of course, we talk a lot about technology and what it can do to accelerate access to care at behavioral health tech. You're really honed in on the outcomes and what needs to take place to make those outcomes come to life. And it sounds like there's a lot of touch in addition to tech. And can you talk a little bit about your approach to that balance, right? Levels of tech and touch.
Sure. Yeah. So I'm a firm believer that technology in this space should be used to help enable care, but not to provide it for behavioral health. To me, and like you said, I'm someone who loves technology. I love AI, but I also know the importance of like real human connection and addiction recovery, just from my own experience. So the way we operate is, number one, all of our coaches are full-time employees. We don't hire contractors. We're really proud of the fact that we have 100% retention of our coaches over 4 years. So when we hire someone, they stay, they grow with us, we promote from within. That's really important, number one, because our team's awesome, even though I'm biased. But two, our clients work with the same peer throughout their entire time with us. So they're building rapport, they're building that relationship, they're building that, anchor touch point in their recovery that they can go to that they know is safe. And then what we do is we use technology to superpower our coaches. So what do I mean by that? Typical things like, obviously, like helping with documentation of session notes, giving our coaches a pre-read of what's happened in prior sessions before they meet with the client so they're up to speed. We use for our toxicology monitoring, the breathalyzers done through our app with AI facial recognition and object detection. Drug testing is done through our app using oral fluid, instant and lab testing, using facial recognition and object detection as well. So rather than somebody needing to run to a lab real quick, they get a text in the morning and it says you have to submit a test in the next 24 hours and we take care of the rest. So they just log in the app, takes 5 minutes and they're done. We use technology to reward people when they're hitting their goals. They earn points in our app and they get things like this cool mug. And, most importantly, I think we use technology to connect the ecosystem that somebody has as a part of their recovery. So the best way to think of our platform is like a reverse electronic health record. So rather than a doctor adding their patient to see their own records, our members add their therapist, psychiatrist, IOP counselor, family member, anybody who's involved in their ecosystem of recovery, and they're able to see everything on our portal. Clinical providers are able to see all of our coaches' session notes. They're also able to put in notes of their own. And then our coaches' time is divided that it's 20 hours for face-to-face work with our members, 17 hours for coordination work, keeping everybody on the same page. So actually actively outreaching, not just saying, here's the portal. And then our coaches also get 3 hours of supervision a week. That's broken down into one-on-one supervision, case studies, and then team cohort meetings.
That's excellent. Now, Matt, I know you've got partnerships with providers and health plans alike. Could you talk a little bit about, for those in our audience, whether it is providers or payers or even other digital providers and innovators looking to partner, what learnings have you gathered from partnering with these organizations? And if you look back, what do you think you could have done to make them more successful, or any learnings on that front?
I would say one thing that, and this is like a personal learning and maybe a company learning as well, maybe this is just something that I needed to figure out as a peer, is when and we still do to a point, we always defer to clinical recommendations, but there's a difference between deferring to clinical recommendations versus not speaking your truth and what you know as somebody in recovery. And what we have really found is it's really important to elevate the peer voice in these conversations, because we bring such a perspective that you can't learn in school. And one of the really cool things about doing this now for 4 years is, like, when I started Accountable, there really wasn't much talk about peer support. So a lot of what we were doing was educating people. And as time has gone on, we found that people now understand the value of peers, are excited about our input. And I think that's really elevated treatment and the field as a whole. But it took, for me personally, a while to find my voice in that. Because this isn't something I have training in, but I have a ton of lived experience in. So being able to find our voice as a team has shown like an immense difference in the outcomes for our patients. Or I should say, our members, are the providers' patients. The other piece, and this ties to it, is just the power of collaboration. So even with our health plan partner, one of them, GEHA, that will be on a panel with at BHT, the amount that we've collaborated with them has been unbelievable. It's made me so excited about actually the potential for like the US healthcare system. Like the way that works with them is like we have case reviews every other week to review cases where people need more help and help them find resources. If there's an urgent need, they're always available. We can reach out, say, hey, this person's really struggling. Let's help find them care together. So having that collaborative touch point with a health insurance company where like I see the people there really care about the health of their members. And it's just been so refreshing and exciting to see. And, we've done really good work together and we've changed a lot of lives. And I'm just excited to keep building on that.
I know I sound like a broken record, but really it's not easy, all the things that you're saying. But great to hear these examples and that there's potential for more of this kind of collaboration that ultimately is going to help individuals struggling. And really happy to hear about all of these use cases that you've shared with us, the great advice you've shared, and appreciate the work you're doing. Thanks so much for joining us on the podcast, Matt.
Thank you, Salome.